If your dog's pee suddenly looks red or bloody, it's easy to panic. But don't worry, there's help. Hi, I'm Lyndall from Vetster, and today we're discussing what it means when your dog's urine looks bloody. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. Alright, let's hand it over to the experts.
Bloody urine in dogs is more common than you might think, and there's more than one possible cause. Some of them are medical emergencies, so it's important to get your dog checked out right away. One of the most common causes of bloody urine is a problem in the urinary tract. Things like bladder infections, kidney stones, or urinary crystals. But it can also point to more serious issues, like toxin exposure, heat stroke, or even a snake bite. Even if your dog seems fine otherwise, bloody urine is always worth a vet visit. It doesn't always look like blood. The urine might be pink, orange, brown, or red, depending on how much blood or other pigments are in it. But the color alone doesn't tell you how serious the problem is. Sometimes it's not blood at all. It could be discharge from the vagina or anus. And in some cases, the urine looks totally normal, even though there's blood or muscle breakdown products in it that only show up on a test. What changes the color? It might be whole blood cells, hemoglobin from broken red blood cells, or myoglobin from muscle damage. Dogs with bloody urine might also strain to pee, go more often, or cry when they go. You might notice belly pain, coughing, pale gums, or bleeding from other places. In severe cases, they might have trouble breathing or seem weak and lethargic. But sometimes there are no other signs at all. The only clue might be a slight discoloration, or something your vet picks up during a routine test. Red urine doesn't always mean blood. There are three main reasons a dog's urine might appear red. If there's actual blood in the urine, it's called hematuria. If it's hemoglobin from broken blood cells, it's hemoglobinuria. And if it's myoglobin from damaged muscles, it's myoglobinuria. Each type points to a different kind of problem. Hematuria means there's bleeding somewhere in the urinary tract. That could be from an infection, stones, cancer, kidney disease, or even trauma. Some conditions, like a low platelet count or rat poison ingestion, can cause bleeding by interfering with the blood's ability to clot. Hemoglobinuria happens when red blood cells are destroyed in the body, and their contents leak into the urine. This can happen with things like acetaminophen poisoning, onion toxicity, heat stroke, certain infections, or immune conditions where the body attacks its own blood cells. Myoglobinuria, on the other hand, comes from muscle damage. After extreme exertion, heat stroke, infections, or a condition called malignant hyperthermia, damaged muscles release myoglobin, which gets filtered by the kidneys and shows up in the urine. So how do vets figure out what's going on? They'll start with a physical exam and ask about your dog's history. From there, they might run urine and blood tests, check how well your dog's blood clots, or use imaging like X-rays and ultrasounds. In some cases, they may recommend genetic testing, surgery, or a biopsy to get a clear diagnosis. Urine tests are especially useful. They can confirm whether the red color is from whole blood, broken blood cells, or muscle proteins. These tests can also detect infections and inflammation. Once the cause is known, treatment can begin. If it's an infection, antibiotics may be needed. If toxins are involved, your dog may need to be stabilized and monitored. Stones might need to be flushed out. A snake bite could require antivenom. In more severe cases, dogs may need surgery or even a blood transfusion. The outcome really depends on what's causing the symptom and how quickly treatment starts. So, is bloody urine always an emergency? Not always, but it can be. Some causes are life-threatening. And since you can't tell how serious it is just by looking at the urine, it's safest to contact a vet anytime you see bloody urine. If your dog also has pale gums, trouble breathing, unusual bleeding, collapses, or has a seizure, go to the emergency vet right away. If you're unsure, you can book a virtual vet appointment through Vetster. A licensed vet can help you decide what to do next, fast. If you do see blood in your dog's urine, don't try to treat it at home. Giving leftover antibiotics or human meds can be harmful. Not all cases are infections, and the wrong medication could make things worse. Delaying care can also make a treatable problem much harder to fix later. So even if your dog seems okay, it's better to play it safe and get professional advice. The bottom line? If your dog's pee looks off, don't second-guess it. Talk to a vet. Catching the problem early gives your dog the best shot at a fast recovery. That's it for this video. Thanks for watching, pups. If you found this helpful, go ahead and hit that like button and subscribe for more expert-backed pet health advice from Vetster.